If governments don't take a far more aggressive stance against global climate change, they're going to pay the penalty, not in mere stocks and bonds and markets, but in lives lost. That's right. The effects of global climate change will have significant impacts on human health, and I believe these pale in comparison. The effects on the market pale in comparison to what is going to happen to human lives across the world. For one, we need to be paying attention to vector-borne diseases. The literature is very clear. The research standard is showing us that vector-borne diseases like malaria, dengue fever, and the West Nile virus are potential threats as the global mean temperature continues to increase. Many of these vectors will seek new geographic locations as the temperature increases so that they will have the ability to survive. And this geographic shift implies a spread. So this is not a tropical problem, but this is a global problem because the temperatures, changes in humidity will affect breeding rates, maturation patterns, and even increases in the transmission season and the ability to create more ticks globally. So we need to be paying attention to finding adaptation measures for these potential changes in the spread of infectious diseases due to vector-borne diseases. And as we saw with COVID-19, what may begin as a local problem can shift to a local epidemic. And a local epidemic can become a global pandemic very quickly due to habits of global trade, urbanization, and travel across the world. Not only should we be concerned about vector-borne diseases, we have to pay attention to heat-related illness due to extreme heat. That's right, exhaustion, cramps, and even death can occur if we don't take climate change more seriously. Let's not forget the 2003 heat wave in France that killed close to 15,000 people in a mere 20 days. We have to prepare for increases in temperature and more extreme heat, and even an increased frequency in heat waves like the one that occurred in France, because this can be the difference between life and death. We also have to be considerate of increases in respiratory diseases, because higher temperatures mean increased potency of many pollutants, which can have a significant impact on lung disease and other respiratory illnesses. We have to pay attention also to allergies, because higher temperatures can mean more pollen and even increase allergy season. And this also, the combination of more pollutants and a longer allergy season can have significant impacts on the number of asthma cases that we see worldwide. Climate-related illness is nothing to play with. And if governments around the world don't take mitigation options more seriously, not only could we see more global pandemics, but we can see lives lost across the country. It's time for mitigation options to be implemented in a more aggressive nature if we're going to have any hope of preventing these potential disease outbreaks and heat-related illnesses in the future. It's time for nations to take action now by working with mitigation options and adaptation options, not only to save economies, save the environment, but to save lives.